How to do a pregnancy test at home. Expecting pregnancy can bring a lot of thoughts to your mind. The joyous question of whether you are pregnant or not can also be the most stressful one. There are several home pregnancy test kits available in the market that can easily answer your question. Let's see what our expert Dr. Shelly Batra, obstetrician and gynecologist, has to say.
Well, advances in science and technology have made life simple for all of us. There was a time when for the pregnancy test you had to collect a sample of urine, go to the nearest lab, submit it and collect the report the next day. Now that is a thing of the past. What do you have to do if you suspect you are pregnant? If you suspect, well, you've missed your period and there could be a happy event in front of you. Naturally, you want to know whether you are pregnant or not, and you can easily do your pregnancy test in the comfort of your own home.
Now that we know we can do a pregnancy test at home, let's see what all we need.
What you need is a clean bottle that can be used to collect the urine sample early morning. Now the bottle should not contain water, it should not contain detergents. You can either clean and thoroughly rinse a bottle and dry it, or you just spend maybe a few rupees and get a urine culture bottle from the chemist. You do not need a sterile specimen, but you need a clean bottle.
We now have the clean bottle ready. Let's find out how to collect the sample.
Now, what do you do to collect your sample? Collect your sample first thing in the morning. As soon as you wake up, the first sample of urine is the best sample to do a urine test with. You do not need a midstream sample. You do not have to follow sterile precautions. Just take a sample in a bottle and keep it on the table in front of you.
Once the sample is ready, it is time to move on to the more crucial steps.
And another thing you need is the pregnancy test kit, which is available at the chemist. Now the test kit comes with a dropper. You fill the dropper with urine and hold the test kit. Keep it flat on the table on a flat surface, not a tilted surface. The test kit looks like a slide, and in the slide there is a circular place, a depression and a rectangular depression next to it. In the circular depression you put 3 drops of urine. Be careful, there are 3 drops of urine and not 3 bubbles with hardly any urine. So what I suggest is that you fill the dropper and practice collecting urine and practice dropping the urine before you actually do the test. Once you've put 3 drops of urine in the well, that's called the well, you leave the slide on the table and wait for 2 minutes.
It seems very easy to use. Let's see how easy it is to interpret the results from the kit.
If you see 2 red lines in the horizontal well, that is an indication that you're pregnant. One line could be lighter than the other. The dark line is the control line. The light line is a test line. And do not get frightened if the line appears light. It doesn't mean the pregnancy is at risk. It only means that you've tested it so early in pregnancy that the hormone level is naturally a little on the lower side. But you are pregnant, so the test has come positive, and now you can go ahead with the subsequent follow-up.